Hey, ear infections are a common problem for many kids, but they can be prevented. A pediatrician will be here in our studios in just a moment to explain in today's Mommy Matters.
Mommy Matters today, ear infections in young children. It's something that all new parents especially struggle with. 3 out of 4 kids are going to have ear infections before the age of 3. We're going to talk about how to prevent them. They're really painful for little guys.
Yeah.
Well, in today's Mommy Matters, 3 out of 4 children will have at least one ear infection by their 3rd birthday. All 3 of mine have already had them before their 1st birthday. They're really painful for little ones, and they're quite common. Can you first of all explain, Dr. Jim Anderson, why these ear infections are so common in little children?
Absolutely. First of all, I did have a little prop here. Let me just kind of show folks what the ear infections are actually. If you look in the ear, you have the middle ear here, you look down the ear canal, then you have your eardrum. On the other side of the eardrum is what we call the middle ear, and that's where the kids get the infection. The eustachian tube is a little tube that goes down from the back of the middle ear to the back of the nose. Now for kids, this is more horizontal, so it's easy for bacteria from the back of the nose to move up. It's more difficult for fluid in the middle ear to drain down, and that's why kids are more predisposed to ear infections than adults. As we hit about 2 to 3 years of age, we start to get more at that 45-degree angle, so the frequency is a whole lot less.
So any runny nose, any drainage can back up and cause that bacteria.
Can increase your risk of getting an ear infection. That's correct.
So can parents do anything to help prevent ear infections in young children?
Yes, there's a number of things you can do. Number one, we found that smoking does significantly increase your risk of ear infections. The irritation from the cigarette smoke causes, again, swelling of the nose, the eustachian tube and the like, and that doesn't necessarily just mean smoking cigarettes around. It can be cigarettes that are on your skin, on your clothes and your hair, so you really want to kind of try to stay away from smoking. The second thing you want to do is to breastfeed the babies. It's shown that breastfeeding really does help to decrease the frequency of ear infections. There's immunoglobulins that help to coat the gastrointestinal tract and the upper back of the throat and upper nasal passages that really help prevent infections. If you are bottle feeding your baby, though, the one thing you want to do is to not prop the bottle. When kids prop the bottle to fall asleep with the bottle in their mouth, what happens is that drips back and irritates that eustachian tube.
So don't let them lay in the bed and hold the bottle back.
That is correct.
Lay flat.
That's correct. Washing your hands is really key to help preventing spreading germs. If your kids are in a child care or daycare setting, try to maybe look for a smaller size daycare to kind of decrease the amount of potential infectious children that your kids may be around. Also, believe it or not, pacifiers. If the kids keep the pacifier over a year of age, studies have shown an increased risk of ear infection. So you want to try to get rid of the pacifier, and then
I'm guilty.
Yeah. And finally, it's important that your kids get their vaccines, particularly the vaccine to help with the pneumococcal bacteria, because some of those strains cause serious infections, and some of those strains also cause ear infections. So vaccines will help to prevent the frequency of those as well.
Preventing them because they are so painful. And if you
Exactly.
suspect one, go see your physician.
Absolutely.
All right, Dr. Anderson, thank you so much.
Glad to be
Hopefully
here.
we'll be all clear of this, though, especially during the holidays.